This is the Facts of Life, a vodcast, where research from the field of family and consumer sciences meets real-life applications. I'm Amanda Harner, a family and consumer sciences agent with the University of Georgia Extension and your host. Our guest today is the United States Department of Agriculture's Director of Food and Nutrition Service, Dr. Caree Cotwright. And these are the facts on the U.S. Department of Agriculture's MyPlate. All right, we're so excited to have you on the podcast, Dr. Cotwright. You have an impressive career. At least I think it's an impressive career. Your bachelor's is in biology from Howard University, and you have a master's and doctorates in nutrition within the Family Consumer Sciences Department of the University of Georgia. You were also tenure on the Family Consumer Sciences faculty at UGA before your current role as Director of Nutrition Security and Health Equity at the U.S. Department of Agriculture. And so while on the faculty at UGA, you were principal investigator, which for those of you who don't know what that means, it basically means that you were in charge of the work that was going on with the research of the Childhood Obesity Prevention Laboratory. And then you also served as a fellow with the Centers of Disease Control and Prevention. So as we both know, there are always bigger stories that lead to where we are currently. And so I'm super curious to hear a little bit more about how you ended up in your current role as Director of Nutrition Security and Health Equity. And beyond all those degrees in academia, what kind of got you even interested in nutrition to begin with?
Oh, well, thank you so much, Amanda. Thank you for the opportunity to be here to speak to you and your listeners today. And I think these are great questions. And so when you think about my story and my journey, this pathway to nutrition, I really started out in biology, as you mentioned, and I was pre-med. I was very focused on being a medical doctor. And I did this intense pre-med program at Medical College of Georgia, and I did some other things, and I was in the hospital, and I just didn't like it. So I had to figure out what were things that I would do. And at this time, my father was ill. He passed away, wonderful man. He passed away when I was 23. And it had to do with cancer, and some diet-related things. And so I started to think more about prevention. And so as I thought about it, I really was kind of lost because you get on this track for pre-med and you don't know kind of where you're headed next. And I always still liked the science. I love the human body. I liked all those things. And my mom just mentioned, you've always liked nutrition. And I thought, yeah. And so I never knew, excuse me, as an undergrad, that nutrition was a major. I just was interested in being pre-med, so I didn't know. And so I started researching programs. And when I was accepted into the University of Georgia, my mentor was actually doing work with Atlanta Public Schools, and I'm a product of Atlanta Public Schools. My mom's is a retired Atlanta Public Schools principal, so it just made sense. It was just a great fit, and I was able to do work educating Black families about nutrition. That was the grant. And so I was just so thrilled to do the work, and I was able to use my talents. I used the arts to teach kids about nutrition, and it just was the best experience in the world. And so as I think about that, that is what led me, because I really, as my master's student said, well, maybe I'll go back, and I love medicine and I'll go back and look into it. But I loved it so much, I decided to earn the PhD right here at UGA, go Dogs. And it had a beautiful experience. And so from there, during my postdoc, I did community-based participatory research. I was a Kellogg Health Scholar in Baltimore, and worked with Head Start centers. So again, going from working in school-based settings to early care and education. And so working with Head Start centers in Baltimore, and making sure that we were starting habits early. And I was kind of ahead of my time. And that's what led me to CDC, because my work was within early care and education. And we were disseminating policies around obesity prevention. And we were just on the cusp of it, because before, we didn't even say childhood obesity. We would only say childhood overweight. That's how new it was. And so we were out disseminating policy. And at that time, the former First Lady Michelle Obama, her initiative, Let's Move Childcare, came about. And I was instrumental in helping to disseminate that policy. So it's been a whirlwind. It's been beautiful. From there, I came back to UGA to teach. That has been wonderful. Teaching and doing research has just been, outstanding for me. It's really been a way for me to learn more, to understand more, and to do things to uplift and empower communities. And you asked about, well, how did you get to this role? I doing the work. I can say it's divine. It's nothing that I could have dreamed up. I tell my students, I didn't sit in my office and say, one day I'll be director of nutrition security and health equity. These things,
Right.
opportunities come. I'm privileged and honored to be in this role. And that's kind of how the path came.
I love hearing people's stories because there's always something in their personal lives, but it's interesting to hear too how their personal lives drive to this opportunity that takes place in a professional sense. And that just kind of snowballs sometimes, especially if you're just, after it
Mhm,
and just
mhm.
working hard and things kind of just come to you. And I think people sense passion in individuals, and that can lead to some really awesome opportunities. I like to ask also just a question for fun. And my fun question for you is what is the most bizarre food that you have ever eaten?
Wow. I've eaten a lot of things bizarre. I went on a cruise with my kids and my family to Turks and Caicos, and they're always giving you new things and you're trying new things. So I would say, and this might not be, this is what comes to mind, escargot and frog legs. And just
Ah,
looking at frog legs, I'm like, I don't want that, but my husband's always challenging me to try new stuff. So
yeah.
I tried that the
Uh,
last time. So that's really fun.
yeah. Did you like them?
It was okay. I still couldn't get past that these look like little froggy legs. So I know they say it tastes like chicken, but I probably won't have it again.
Yeah. I found it a little challenging too when we first moved to Macon. We went to a restaurant and got some, and we were actually intending to try alligator and got frog legs because they were out of alligator. And I had a hard time getting past the legs as well. That there's no getting around. They look exactly like frog legs. You know exactly what you're eating.
Yes.
And yeah, I could see the kind of claim that people make that they taste like chicken, and at the same time that they kind of don't taste like chicken. It's like a fishy chicken.
Yeah, it's a thing. So I did try it. I'm very brave and my kids tried it. So we had fun and you asked too about this journey in nutrition. I love just incorporating my family and a big part of my
Yeah.
love for nutrition, even though my mom was saying, hey, you always like nutrition. It was because she was a gardener. It was because my grandmother was a gardener.
Mm,
It's because she taught me to cook when I was 5. And I carry those traditions, with my kids. And we have gardening and they love to cook and they love to try fruits and veggies. And so passing that down is so
yeah.
important to me and it's important for our communities. And one of the things that is really great about being in this role is that I research programs that are essential, a part of our nutrition assistant program at USDA, which are like the Child and Adult Care Food Program, which serves
Mhm.
our early care and education centers, and SNAP-Ed. And so researching with that, understanding it from that side, and then
Mm.
understanding it from this side has been really wonderful. So I forgot to mention that and I wanted to bring it up.
Yeah, it's nice when things kind of come full circle and they kind of inform one another. Let's kind of dive in. The whole reason that you're on the show is to really talk about the USDA's MyPlate. Some people aren't familiar with MyPlate. People who are in their midlife or older are probably more familiar with the pyramid
Mhm.
to describe what healthy eating is, or well-rounded nutritional consumption of food would be. Could you tell us a little more about the history behind MyPlate? I found it really interesting when I was in my master's of nutrition because I think people don't really understand how much really goes into these tools that the USDA provides. And MyPlate is kind of the face of the beginning of those tools.
And so, as you mentioned, we have the pyramid, and we transition from the pyramid, and so in terms of doing that, my plate is our federal symbol for healthy eating, and it really looks at an icon of a plate, which makes it understandable and simple. Where we make half of our plate fruits and vegetables, and then we include our protein and grains and dairy, which is based on the food groups. And so, as we look at that, one of Secretary Vilsack's next major efforts for our nutrition security initiative.
The U.S. Department of Agriculture states that nutrition security means all Americans have consistent and equitable access to healthy, safe, affordable foods, essential to optimal health and well-being. Their approach to tackling food and nutrition insecurity aims to first recognize that structural inequalities make it hard for many people to eat healthy and be physically active, and second, emphasize taking an equity lens to their efforts. Poor nutrition is a leading cause of illness in the United States and is associated with more than 500,000 deaths per year. It is linked with increased risk of obesity, diabetes, and heart disease, as well as broader impacts, including higher health care costs and decreased productivity.
Is to make MyPlate a household brand. We want to push people from the pyramid over to MyPlate, so that they can really understand that it's a symbol for healthy eating and be guided. Have some guidance related to that. And so as we look at that, we want to raise awareness. We want to make sure that people are familiar with the tools that we have to make MyPlate useful to them, and then making sure that they're able to maximize the benefits of our nutrition assistance programs. We have 16 nutrition assistance programs that help our population to thrive, to really be able to have food on their plates. And so as we think about that, this is a tool that helps to guide people toward healthy eating.
Because it's federal, all 16 of those programs that you mentioned can all reference one tool and kind of have people on the same page. Anything that the USDA is putting out in this regard, it's going to have research behind it. Can you talk a little bit about why that's important? These are long periods of time that this research has gone on too. Maybe unpack that a little bit so that they understand what a wealth of knowledge goes into this resource.
Well, I want to make sure the listeners know that the MyPlate and the work that we're doing at USDA for our programs is all based in the latest nutrition science. And so as we think about that, many of your listeners may have heard of the guidelines, the dietary guidelines for Americans. And so really MyPlate is that consumer facing part of the dietary guidelines for Americans. And so we know that that is all based in science. We have dietary reference intakes, and we really think about what we're promoting. And so that larger, the dietary guidelines for Americans is more for professionals and for policymakers. But then we have this basically a consumer facing translation of all of those points that we put together that are based on the science. So when our committee meets, they look at the latest nutrition science research, and that is really how we get to what is promoted in MyPlate. And I can't say enough how much it's not just the icon. We do want people to know what the icon is, but we also want people to know, looking at that plate, that there are tons of resources that we house on myplate.gov that really help people to navigate their healthy eating. So it's the icon that is augmented by these resources and tools that really help people get at how to understand eating healthier.
Maybe let's unpack a little bit some of those other resources. So one of the things that I really like, I access MyPlate websites a lot in what I do. As I've gotten more familiar with it, one of the things that I really like that is super accessible to people these days is the app. And I'm pretty sure that hasn't been out all that long, and you guys are always kind of making adjustments as needed to lots of different things. But can you speak a little bit to practically, like, what are the resources that are there just for the consumer to look up themselves?
Certainly. So we have myplate.gov that houses lots of information. It houses resources. It houses recipes, ways to prepare meals and look at your calories, all the things about the food groups. Wonderful, wonderful, beautiful resource that's updated quite often, as you said. We have the MyPlate app that helps people on their phones so they can look at that and look at the different food components and ways to build a healthy plate. And we have, for the very first time in the Food and Nutrition Service, the MyPlate Instagram page. We are very proud of it. And so going onto that page and looking at up to date, again, social media, we're always putting up content. It really helps to put up the most up to date materials that are related to MyPlate. And so that handle is at myplate_gov. And so you can go on there as well. But really just a ton of again, recipes, resources. We're working on ways to make sure that people understand MyPlate in both contextually, linguistically, and culturally. And so you'll see ways that we are pointing to that on the website and ways that we are working to improve it. But I mean, there's just such a plethora of information and resources that you can tap into. And one of my favorites, as you said, you tap into the website a lot, is the recipes. So you're a mom or anybody, a busy person trying to figure out what types of meals can I make to make a healthy plate. And the resources and the materials are all there, and the recipes are wonderful.
Yeah, and I think I want to notate, just bring it out a little bit more, something that you mentioned, which is something that I really appreciate with USDA and various people who are connected with the work with MyPlate, that it is an evolving tool. On one hand, some of that is slow because we don't want to like constantly have an upheaval. But on the other hand, some of where it's evolving is in the area of having more resources available in regard to things that you mentioned linguistically. So with various languages, so things being translated into the languages that Americans encounter across the United States. Things like making sure that culturally people are seeing themselves represented, right? And the foods that they love and are important to them as families and connected with their cultures. Those are all things that you are all working a lot on making that even more available and more adaptive, correct?
Yes, yes. And so we're working on that. And again, our dietary guidelines for Americans committee is meeting right now. So one of the things that we're doing is taking into account our consumer base with audiences. And so as we lift this effort to make MyPlate a household brand, I'll be out doing a listening tour. We're out doing more with social media. And we really want to hear from people. What are your successes? What are your challenges? We know there are people out there doing great work with MyPlate, but if we can find ways to improve, that's why we want to listen to various audiences. Another thing that we have in terms of the resources on myplate.gov that I didn't mention is that we have Shop Simple with MyPlate. And we really want to allow our consumers and participants to be able to make a healthy plate on a budget. And so Shop Simple helps them to do that, thinking about buying foods in their area, making sure that they're able to have a plan and a guide. There are also meal planning resources on the myplate.gov. Another resource we have that many people may not know about is MyPlate on Alexa. You can go to Alexa and get MyPlate nutrition tips. Just ask Alexa, you can ask her many things, but I don't know if people know that you can ask Alexa about MyPlate as well for nutrition tips. So it's right there in your kitchen. You can just ask questions and see. So again, those are some new things that people may not know about. But again, those recipes, shopping healthy on a budget, having a plan, those are all ways that we help to improve our healthy eating. And then on the app, as they're working through it and thinking about their daily plan, they can look at it by food group and in the format of the plate.
I really like that you mentioned Alexa because that's one that I forget. And there's some other tools that, you mentioned. I just, I think this is the whole reason of doing a focused podcast episode on MyPlate, right? Because I think they see the icon and I feel like it's easy to think that it stops there. And I mean, I work with this almost on a daily basis and I forget about some of the resources that are out there. So yeah, I love that you guys are working on so many areas that meet the needs of a diverse population. And I just want to say, like, that's hard work, right? It's not easy to try to take into consideration all the demographics in a population like the United States and making sure that you communicate well to all those populations and that they find it useful, and to constantly be asking the questions to make the improvements where improvements need to possibly be made and stuff too is quite the task, right?
Yeah, and let me mention, we do have MyPlate graphics, and we have it available in many languages. I think
Mm.
I know it's over 50%, but if you go to the website and you want to look at the graphics, we have MyPlate resources available in many languages. We also have, for people who may not have even heard of MyPlate, a way to get your resources more personalized is to take the MyPlate quiz. Just start off, get started today. It helps you to set personal goals on what you're trying to improve. Are you trying to get more fruits and vegetables into your diet? Making sure that you know about that. And again, having a plan. And on the myplate.gov website, one of our core messages is to make every bite count. And so
Mm.
the way that we do that, we know that, again, and I'm a registered dietitian as well, is to think about what is the plan. If we don't plan our meals and we just eat when we're hungry, we can't necessarily make every bite count. We're hungry, we're going to eat, the things that are available in there. But if we have a plan, and we think about these tools, it's for you, it's for your family, it's for everybody in every life stage. And that's what we want to think about. And so, as you know, again, it's based on the dietary guidelines for Americans. We also have the MyPlate Kitchen, and that's where all the recipes and everything are housed. And there are also videos as well to help, people to think about how we have, I love those little tasty videos with the hands and everything that helps.
Yeah.
But we also have our information by life stages. So say you're working with preschoolers and you need to figure out, what do I do with MyPlate and preschoolers? It's all housed on there, and the website is so beautifully laid out. It's very simple. And again, when you look at what is MyPlate, you can look at things by the food group. And there's also a
Mm.
food group quiz. So again, it's really educating people. And I don't know that everybody is aware of all the resources. You see the icon, but we got to nail forward that there are tons of wonderful resources that are going to help you get to where you want to in terms of healthy eating.
One of the things that I really appreciate about moving away from a pyramid to a plate is it is visually what we see 3 times a day.
Mm-hmm, mm-hmm, mm-hmm.
If we're eating a meal 3 times a day, it is visually how we are seeing our food.
Yes.
And so that's helpful. I mean, you could argue, well, I mean, I also see it in a bowl sometimes and that kind of thing. But I do think having it in a plate format is still easy too, because even if you're making a dish that everything goes together, where it's like a grain bowl or something, if you divided it up on the plate, you would see that you have all those components. I still personally like the pyramid to maybe as a tool to describe what a people group's diet looks like. But in a practical sense, as an icon, I really like the plate tool. And there's a lot of other programs out there across the world who are moving to similar types of icons too.
Mm-hmm, mm-hmm. Definitely. And I'll just go back and mention, when again we have the plate, we have that icon, but when you go on the website and you think about the MyPlate plan, it really does do your personal food plan based on your calorie needs, your height, your sex, your weight, your age, all of those things. So again, when you go into the resources and the tools that we have, they really do make it more personalized. And so some of the things that people might be missing from the pyramid, or things that they're familiar with, if you go in and use the resources, they really do augment MyPlate. And let me mention this as well, Amanda. We also have, as you said, we want to reach consumers where they are. We have the MyPlate National Strategic Partnership, which is a public-private partnership where we have people from industry, grocery retailers, just all types of people, all types of organizations that are helping to get the word out about MyPlate. And so one of the examples is that Goya and McCormick Science Institute, for example, got together to make resources for Mi Plato, which is the Spanish speaking version of MyPlate, Spanish language version. And so again, even when you go to look at the MyPlate plan, you can get your plan in Spanish. And so again, we're working on that, and we're looking at our other needs in terms of how do we expand that? How do we make things linguistically appropriate, culturally appropriate, and all those things that you mentioned. So I just wanted to make sure that I lifted up our partnership as well, because they are key in helping us to reach more consumers.
Are there resources with MyPlate that are focused on Native American nations?
Mm-hmm. We work very closely we have at USDA a tribal food sovereignty initiative. And so I actually recently just talked to a Native American dietitian. And one of the things that we know is a resource that is used in our amongst our tribes is the basically the tribal MyPlate, the native
Mm.
MyPlate. And so again, while there are many different audiences and organizations that may augment my plate for their audiences, we do start with, of course, our federal symbol. But
Mm.
we are aware of the other resources that people are using. And again, it's just an extension of what we're doing. And so while you will see us promoting specifically my plate as it is, we're aware of the native my plate and how they are using the tool to make certain that it reaches communities and it reaches the people that they are serving.
What are, if any, some limitations of MyPlate from your perspective?
Well, I think one of the things that we're working toward, Amanda, is making certain that my plate is culturally appropriate, that people can see themselves represented in my plate because it is our federal symbol for healthy eating, that it's linguistically appropriate. Again, we talked about having it in different languages, but making sure that we have the capacity to translate our resources and those things. And then also just contextually, we want to make
Mm.
sure it's practical. And so that's why you see us on Alexa, that's why you see us on Instagram. We want to make sure that it reaches people where they are. And that's why we partner with other organizations to make sure that consumers are getting this information and they're learning about my plate. And that's why we're working to make it a household brand. And so as I think about it, the limitations that we've identified, we're working on doing better. And so we know we can do better together. And that's why we want to hear from audiences and communities. And we want to know what are successes and challenges so that we can make this tool universal and make sure that everyone is able to tap into it so that they can be eating healthier.
Awesome. So, healthier was a great pivot point. I would love to hear your thoughts on how you guys approach when you're thinking of healthy. What does that mean? I talked about this in a podcast on fad diets. And one of the things that we discussed was how the public sometimes may have a different definition of healthy than we maybe have as nutrition professionals. And part of that being that, we kind of throw that word healthy around in a way that it means a lot of things to a lot of people. So when we're thinking about it in terms of my plate, can you unpack a little bit how we're thinking about how you as the USDA are thinking about that word healthy and nutrition?
Yes, we're thinking about, oh, and I'm going to go a little bit further back. My title is I'm the Director of Nutrition Security and Health Equity. And so as
Mhm.
we think about our nutrition assistance programs, a big part, nutrition security is what we do. And so as you think about the definition for that, it really means that everyone in our country has consistent and equitable access to healthy, safe, and affordable food that is optimal for their health and well-being. And so
Mm.
as we think about that, when we say healthy, we are thinking about food that is optimal for your health and well-being. Okay. And so
Mhm.
some of the things that we think about are keeping it simple, keeping your meal simple. And it really is based on the food groups, and which is what? Based on the science. And so if
Mhm.
you are getting your plate, if you're setting up your plate in the way that my plate is, half your plate fruit and vegetables, you have your proteins, you have your grains, you have your dairy, that you are getting the nutrients that you need that are optimal for your health and well-being. And you know that again, we're making half our plate fruits and vegetables. You know the research, you know that everybody knows in general that those are the foods that are going to be healthier where we're going to get our nutrients. And so what
Mhm.
happens is with my plate, as we have our recipes and our plans, that helps us to think about ways to prepare these dishes so that we can get the nutrients that our bodies need to thrive. And so as we think about that, it really is based on the science and laying out those food groups in a way that our bodies have optimal benefits so that we can live a healthier lifestyle and prevent disease.
In your role, do you feel like the public really needs to be aware of in regard to the topic of my plate that we haven't covered?
Hmm. I think that we just need to consider again, we want everyone to know about it. I think about making that icon so recognizable that everyone knows about it and that we demystify how what we need to do to eat healthy. We know it's just not a matter of access. We know it's not just that, because people have to have skills, right? And so
Mm-hmm.
as we're working together as partners, as you do through extension, as we do as registered dietitians, all of those things, and having these tools and having this as a guide really helps us. And as we think about that, and we think about all the work we do at USDA and FNS to make sure that our participants are able to have food on the table, again, healthy, safe, and affordable food. It's so important. And so we're working to make MyPlate a household name. We want to make sure that everyone sees themselves represented. And that's why we're going to listen to people. That's why we are celebrating MyPlate, and we want to do this together. So I would say one of the most important things is that we're interested in hearing your success stories. We're interested in hearing challenges, because we want to do better. And we love hearing from everyone. And so with that, being able to, reach out to me, reach out to our Center for Nutrition Policy and Promotion, making sure that if you want, different things, to see different things represented, both culturally, contextually, linguistically, that we know about them. Because I think that one of the things you can see is that we are dedicated to making MyPlate better and making it accessible for everyone. And so again, we can only make it a household name if people talk about it, if we get the word out, and we're very excited and passionate about that. The CNPP team is so committed. We have so many wonderful partnerships, and we're out here trying to do the work to amplify MyPlate. And so as we do this work, we know we can only do better together. And that's what we're working to do. So everyone's voice counts. Your voices matter. And we're so excited about the work we're doing. Know that it is grounded in the science. Know that it is there for you. And it is a tool that is wonderful, and it's fun. And I'm just excited about making it a household name.
On that note, Dr. Cotwright, thank you so much for your time. I know your time is very limited and valued by many. And so I really appreciate you taking the time for this podcast interview.
Thank you so much. It's a pleasure to be here, Amanda. Thanks for having me on.
The Facts of Life is a program by the University of Georgia Extension, an equal opportunity affirmative action veteran disability institution. Research-based resources referenced in and related to this episode of Facts of Life can be found in the episode notes and description information. The views and thoughts expressed in this video podcast are the speaker's own and do not necessarily represent the views, thoughts, and opinions of the University of Georgia or the guest organizations and/or employers. The material and information presented here is for general information purposes only. The University of Georgia name, as well as those of guest organizations and all forms and abbreviations, are the property of its owner, and its use does not imply endorsement of or opposition to any specific organization, product, or service. These are the Facts of Life. Thanks for joining us. Check out our website at factsoflife.extension.uga.edu. That's FACS of life.extension.uga.edu.